Hello and welcome to another episode of the Peninsula Biz Buzz. My name is Shelley Smith here for Premier Report and Penn Shern, and my co-host. Over to you, Bob.
Hey everybody, Bob McKenna from the Virginia Peninsula Chamber of Commerce, and we're here today for a new episode of Peninsula Biz Buzz with Kapua Conley, who is the president of Sentara CarePlex, and Dr. Tony Fisher, who is the vice president of medical affairs at Sentara CarePlex. So guys, what the intent here is to provide a forum for you to get important word out to the community about what you're doing and how the community can assist and how they must assist. So right off the bat, I'd like to ask the question, 5 or 6 weeks ago, we all were just kind of going about business as normal. What was Sentara CarePlex's mission then? And how has it changed? I know drastically. How has it changed in the last month?
Well, I would say, honestly, 5, 6 weeks ago, we were looking at our operational design response to COVID. The system had stood up an incident command center. We were shortly following forming incident command. What that essentially is a team of our hospital staff who are experts in emergency management and organizing logistics, communication, clinical, and really prepping for the crisis that was beginning to take focus. I will say that our mission hasn't changed. Our mission is always to improve health every day. But in the short term, as the crisis has evolved, we have had to change how we manage health because we need to continue to take care of patients, take care of this new population, and minimize exposure to our staff and community as well. And that's taken on a lot of forms. So we've modified our access to emergency rooms, screen patients to keep patients and staff safe. Physicians have had to change their schedules. There are some patients that are not safe to be seen in the office. So telehealth has been around for a while, but we as a hospital and the system have pivoted very quickly to utilize that platform to screen patients, to offer them care outside the office so that we can continue to keep our community and staff safe. I did want to say, as far as community response, I think we've been really blessed. We've been very appreciative of the response we've seen. There have been many vendors who have supplied large amounts of PPE to CarePlex. We received many food offers, snack offers that the staff's very appreciative of. Folks have volunteered their time. Specifically, healthcare staff, physicians in the community have volunteered to help us with the crisis. And one other thing, as far as when we look at providing care, it's a balance between the influx of patients that we anticipate, the staff that we have to care for them. So sometimes it's modifying, how we manage patients, how we treat a population that might exceed our typical capacity at the hospital. And it's also looking at, what supplies we have as far as keeping staff safe, the PPE that people have heard in the news. And so some of that is managing our surgical procedures and doing that in a safe fashion to preserve staff, preserve PPE.
Yeah, and just to kind of reiterate what Dr. Fisher said, I don't think our mission has changed at all. If anything, it kind of highlights to the community why we're here on the peninsula. Sentara has a very large presence. So between the hospitals, freestanding EDs, and our medical group, this is a time for us to kind of rally the troops and make sure that we can continue to deliver great care to the community. The approach is definitely different. We're looking at things differently now, and we're trying to minimize the exposure not only to the community but to our staff. But, the mission has always been in place to improve the health and wellness of our community.
So Kapua, I look back just a little over a month ago, about 5 weeks ago, I guess you called me. We're supposed to have Lead Peninsula was supposed to visit Sentara CarePlex on, I think it was the 12th of March. And we made the decision, you and I together, that it wasn't a good idea. And I don't think I anticipated having you on a podcast 5 weeks later talking about this crisis as it has unfolded. But it was a good call, it turns out, right? So are there things that are not, so I know a lot of hospitals have canceled elective surgeries and stuff like that. Are there things that are not going on at Sentara CarePlex now that went on previously that you were doing 5 weeks ago?
Yeah, so, and I'll let Dr. Fisher jump in anytime. What we're really having to do is prioritize based off need. In some point in time, in some cases, historically, when we didn't have the pandemic surrounding us, our prioritization was based off need but availability. And so now, and other factors as well, too. But now we're really having to kind of ask the question, does this person need this done now, or can we postpone it? Because understanding that the potential of exposure could actually compromise the patient more than actually doing that procedure, that elective procedure. So, our criteria has changed in an effort to protect the community and also meet the guidelines that were given to us not only by CMS but also by the governor's order.
Okay, and so so you mentioned, Dr. Fisher, you mentioned how the staff's schedules have changed a little bit. How have the schedules been impacted? Are people working time and a half? Are they working longer hours? Are they working different shifts? Do you have people who are doing different things before now pitching in for the crisis?
Correct. So as we've had to shift how we're delivering care and anticipating potentially opening up capacity that we didn't have before the crisis, there are employees that have found that maybe the workload in their area has decreased, whereas the workload in other areas has increased. So it's been taking the staff, looking at what their skill set is, and repurposing them to other duties and functions in the hospital. Some of it is working the command center. Some of it is utilized in patient care areas. Some of it is maybe manning our entrances to ensure that everyone that enters the facility is safe. So one thing that I will say is Sentara CarePlex and the system as a whole is not furloughed employees, and there are no plans to do so moving forward. We feel that we need kind of all hands on deck, and that is what our ongoing philosophy is.
And how is the loading in the intensive care unit now?
So we actually have one of the largest intensive care units in the area in the system. So we are still running a little below our capacity. We have expanded what we generally utilize for an ICU to additional rooms, and we've made preparation to expand further if there is need. The system has set forth a committee that looks at the demands, the needs of each hospital, and is able to allocate resources, whether in the community or from other places in the system of providers, to help augment the care structure we already have in place.
Shelley, over to you.
I was just going to say, are those practices being shared, obviously not only inside the walls of Sentara as a whole, but for the community, the other community hospitals as well? I assume that there are some great things that are happening to share what each location is transparent. Is there anything like that you could share with the listeners as well?
Sure, absolutely. So on normal circumstances, I feel I have a good relationship with the chief medical officers at Mary Immaculate and Riverside. I think we have a good working relationship and understanding. When this started 4 weeks ago, we did stand up a Lower Peninsula meeting of CMOs, so it includes some of the large medical groups in the area, TPMG being one, Mary Immaculate, Riverside, as well as Langley, VA, and the urgent care centers. With the success of that, there was a feeling by the system to extend it out beyond the Lower Peninsula, and so now we include the Upper Peninsula, and we include all of Southampton Roads as far as this kind of collaborative CMO conversation, and we generally discuss pertinent topics among the group. If there are concerns or questions or asks of the other hospital, we get that out as well, and it is coordinating care models and really sharing information because we're all in this together.
Yeah, that's beautiful. Are there things that for the listeners and the viewers should know from a community perspective that they can do to help in the time, to help support everything that you're doing for your patients, but also for your employees? Is there anything the community can do?
Well, this is Kapua. One of the things that I do want to encourage people is still adhere to the social distancing. Because of the efforts by the governor and also by BDH, our modeling has changed significantly over the last 2 weeks, and so that we we've seen an impact, and although we don't necessarily see the volume we anticipated, there's still a lot to do. And so I think continue to emphasize the importance of social distancing as it relates to slowing down the pandemic's growth.
Are there any, go ahead.
I was just going to say, I think that's well said, Kapua, and that is exactly what I was going to advise. I think we're seeing the social distancing has had significant impact. We're seeing the models shift, and one of the benefits, we've heard flattening the curve a lot, is the hope that you can lower the surge to a point where you don't overwhelm the health system, and that appears to be what we're seeing right now.
Bob?
Okay, so on that note, there's a lot of talk right now about getting back to work, and it's being talked about by the governors, by some of the localities, and certainly by the federal government. What things need to be in place from a public health standpoint before we can actually start getting back to work?
So I think definitely, importance is partnering with our public health organizations. I did forget to mention, and I shouldn't have, that they are partners on our weekly calls. It has to be a real thoughtful approach. We need to, look at where the predictive models are putting us and be thoughtful of those models as far as, when is the point that we feel it's a comfortable time to begin to get back to business as usual. And it's going to be a slow process. We can't just all of a sudden flip the switch and be back to business as usual. For us with surgeries, it is looking at all variables. It's looking at, length of surgery, what the PPE availability is, the staffing, what the prevalence in the community. I think it'll also be important that we be able to expand testing in the community to look a little bit more closely as far as what our prevalence is. And I think that'll help us model, what the appropriate time frame, what the appropriate reintroduction of normalcy is.
Bob, I think trying to piggyback off what Dr. Fisher said, I think availability of testing is probably critical to kind of slowly opening the community back up and identifying areas that have high prevalence versus those that are showing slower COVID instances. So, I think that's something across the nation that we're looking to kind of address. We develop our in-house lab, but obviously some of the that we can do COVID testing. But it's not a capacity concern for us really about doing the test. It's just the supply chain. And so, trying to manage the limited supply chain that we have with the ability to do rapid COVID testing, it's a balancing act at this point in trying to triage the more sick versus the proactive side of it, and trying to look at to potentially reopen.
So for a couple of weeks there, Kapua, you were doing, was it like drive-by testing in the parking lot? Is that correct?
We were. We were the only between. Sentara was the only one between, actually in the state of Virginia, that was actually doing drive-through screening. We had supplies on hand, and we felt like it was the best thing to do for our community is try to get the screening out. Williamsburg was the first place to go up with Princess Anne, and then it was followed by Norfolk and Hampton on the Lower Peninsula. And so we did that for close to 2 weeks until our supplies got critically low, and we had to kind of slow it down. The other thing that we were also concerned at the time we were doing the screening is we didn't have the ability to do in-house testing, and so we didn't want to back up LabCorp and some of the state testing facilities. So again, it's that fine balancing act, and so we ran through our supplies and slowed that down, and now really the testing we're doing are for patients that are presenting with symptoms in the ED. Okay,
I got one more question on the way ahead, of course. So social distancing, so 6 feet seems to be the answer, right? Wearing mask when you can't be, keeping that 6 to 10 feet away from people, and washing your hands. Is that still consistent? Is that still the best advice to give to the general public?
Yeah, absolutely. And thank you for commenting on or speaking to the masking and hand washing. So I would say masking is important whenever you're in public. well as the social distancing. And the thought behind the mask is initially when we started discussing COVID, masking the unhealthy people because it helps trap those droplets, prevent them from being spread. But what we are seeing is that there are folks that are relatively symptomatic that can still shed the virus, up to 30% of people. And having those masks on not only protects the person wearing the mask, but also if they're an asymptomatic shedder, keeps them from infecting others in public. Hand washing is critically important, and we do recommend that it's either hand washing 20 seconds, making sure it's a thorough hand wash, whenever you're in contact from anything that you're not familiar with, or using hand sanitizer, at least 60% isopropyl alcohol to cleanse the hands as well. And when you use that, it should be until your hands are fully dry. But those are really the three critical elements as far as minimizing the spread of this illness.
Okay, and one more question for the doctor. How about how to boost your immune system? I've seen a lot of stuff on boosting your immune system. Are there things you can do in the short term, or is it too late if you don't already have a good immune system?
So there's and Sentara has looked at the evidence behind everything that's kind of touted, whether it's treatment. We've all heard of hydroxychloroquine, but immune boosters. And there's is there harm of taking vitamin C? No, not really. If it's not beneficial, you'll just pass in your urine, but it's not really recommended. So there have been some discussion about melatonin as far as could it decrease the immune response. And, again, there have been no randomized clinical trials. It's not harmful. So I guess this is a big roundabout way of saying, no, I think the things that we always know help improve our immune system. So, eating a good regular diet and getting plenty of sleep is really what's going to be beneficial.
And getting out and soaking up that vitamin D from the sun's rays, right?
Vitamin D is definitely helpful, but make sure that if you're soaking up, you're at least 6 feet apart from folks.
Gotcha. All right. All right, Shelley, over to you.
Fair enough. So thank you for this great information today and the update. Is there anything that we didn't ask you or that you want to tell the listeners and viewers that you've not yet expressed?
Well, we said it earlier, but, on behalf of CarePlex and the team here on the Peninsula, we do appreciate everyone's support. It has been amazing to see the community rally behind all the care providers, whether it be Sentara, Riverside, or Bon Secours, Mary Immaculate. It just says a lot about the community. Not only the people that live here, but also the business community have been very supportive and extremely accommodating. We had examples of some of the ministries giving food to our staff's families because they knew our staff here were pulling a lot of hours trying to take care of COVID patients. So we just appreciate everyone's reaching out and everyone's well wishes, and it is definitely appreciated by the staff, and we thank everyone for their support.
Fantastic. Well, thank you again for being on the show today. Again, for those of you who are watching, please make sure you're commenting and sharing and giving recommendations to Bob and myself of others that you would like to have some updates on and additional information. So that's it for me. Bob, over to you for a final closing.
Just want to say thanks, gentlemen. And I've said this before on some of the podcasts we've done. It gives me hope and optimism that we have great professionals like you two who are working on moving ahead, finding a way ahead, and getting past this crisis, unlike any other in our nation's history, at least in the 57 years that I've been here. So I appreciate what you're doing. I appreciate you taking time from your obviously busy schedule to be with us today. And last word for you guys.
No, I'm just appreciating the goatee, Bob. Kind of jealous.
Yeah, I'm working on the rest of it too, but my wife doesn't like that too much. So.
All right.
All right. Thank you so much.
All right. Thanks, guys.